6:30 p.m. on May 28th. Thank you for joining us. This is Janet Hill at the Rock Island County Health Department. Today we have with us Mike Miller of the Riverbend Foodbank, Nita Ludwig of the Rock Island County Health Department, Ed Rivers of the Scott County Health Department, and as always, we will take your questions at the end of the briefing. Brooke Barnes of the Scott County Health Department will be the moderator. We ask that you put your questions in the chat box. Thank you very much. Nita, please give us our Rock Island County numbers.
Hi, today we have 2 new cases reported for Rock Island County Health Department, which brings our grand total to 688 total cases in Rock Island County, and we are still at 26 deaths for Rock Island County. 9 patients are currently in the hospital.
Nita, do you want to go ahead and talk on your points as well for today, and then we'll have Ed do the introduction for our speaker for today.
Great. So during his daily coronavirus press briefings, Governor J.B. Pritzker has reported that Illinois Department of Public Health now is publishing recovery rate on its website. He said the information is being given to reassure the public that COVID-19 is not a death sentence and that the vast majority of individuals who test positive eventually recover. IDPH calculates the recovery number at 92% through a complicated formula. IDPH also breaks it down by region. So this is how it looks in Rock Island County this week, though we must know that the data is sometimes delayed and sometimes a lag has occurred. So for asymptomatic or people that have COVID-19 that have no symptoms, it's around 5.94%. We have a deceased rate in Rock Island County currently of 3.44. People that are still symptomatic but are still recovering at home is about 47.9%. And still symptomatic and hospitalized, about 5.6% of those. The people that have their symptoms resolved is at 27%, and an unknown symptom status is 2%. Then we do have an unspecified category of about 7%. So about half of the people are still symptomatic and at home at this time. We've told you all along that about 80% of people who test positive for COVID-19 will have mild to moderate symptoms and then recover. All of us must worry about that 20% whose immune symptoms are not strong enough to fight off the virus, and patients that don't know whether they are strong enough to fight it off until they have it. Today we reported that a woman in her 20s is hospitalized with COVID-19, and earlier this month, a man in his 30s passed away. Now, I would imagine neither of them considered themselves at substantial risk being that young. Indeed, about 500 of our 688 cases have been people younger than 60 who could have passed away from the virus, who could have passed down the virus to others that weren't as strong as they are. This is why we say stay home as much as possible and keep at least 6 feet between you and others. Wear the face coverings when you're out and you can't maintain the social distancing, and wash your hands frequently, and that is the best defense against getting COVID-19 at this time. Illinois moves to the more relaxed phase 3 status tomorrow, but the virus isn't taking the summer off. So please remember everything you've learned about COVID-19 as we navigate the new normal. Thank you.
In Scott County, as we speak, the number of cases is listed as 351. Unfortunately, another death has been reported. That brings our total to 10. And our number of recovered is listed as 289. Many of our messages around COVID-19 have focused on the health impact on individuals and families in our community. However, in public health, we know that the environments in which we live, learn, work, play, worship, and age affect our health and our ability to thrive. Education, social aspects of our communities, neighborhoods and built environments, and economic stability. We call these the social determinants of health. We know our education system has been stretched. and asked to do things it's never done. This has affected our children, educators, families, and employers. We know the social services community that acts as a safety net to many has also been asked to stretch, serve more individuals in need of assistance, and in new ways. Our neighborhoods and built environments have also changed due to the impacts of COVID-19. Many community groups have had to cease meeting or change how they support their members. Community programs have had to pause operations, and many of our outdoor built environments that provide safe places for members of our community have had to stay closed in order to prevent the spread of the virus. We also know economic stability has been affected across our community. Those who are most vulnerable, families dealing with layoffs, and businesses suffered from lost sales and loss of employees. The effects on economic stability influence transportation, employment, housing, and access to food. In spite of the challenges we've experienced in all areas of our community, we've seen our community adapt and innovate to help support individuals, families, and businesses to make their way through this difficult situation. It's a long road, but we're in it together. We're joined today by Mike Miller, President and CEO of the Riverbend Foodbank. Mike is a champion for food access for our community, and we welcome his updates on how food access needs have been increased and Riverbend Foodbank is meeting those needs.
Thank you, Ed. As everyone knows, Riverbend Foodbank has been deeply involved in the COVID-19 response since the onset of the virus. At the same time, the food bank is experiencing what I've been referring to as a triple threat of factors that are affecting our work. There's significantly increased demand, a seriously interrupted supply chain, and substantially inhibited operational methods like social distancing, no contact food distribution, and the sort. Today, I'm going to focus on those first two factors. First is the increase in demand. Feeding America, the national network of food banks, estimates that food insecurity is up 46% nationally. And of course, that average is skewed by the hot spots like New York City and the like. And so Riverbend Food Bank is just over 30% in the 23 counties that we serve. But my focus today is really on the interrupted supply chain. Just as the public is seeing shortages in grocery stores, the food bank is also receiving less donated food, which requires more purchased food to ensure a sufficient supply to meet this increased demand. The food bank normally distributes about 70% donated food, 20% that comes from government programs, and 10% that we purchase. And in April, we were down to 56% donated, 29% from government programs, and 15% that was purchased. And normally the purchased product is sold to agencies who pay whatever price we paid for it. We don't mark it up at all. But what we are currently purchasing to supplement donated food is being made available at no cost, which is significantly, had a significant impact on our expenses. Lastly, there are some foods you can't even buy right now. I can't find shelf-stable protein anywhere. So canned meats, peanut butter, chili, and the like. And there are other products with very extended lead times, things that we can buy them now, but won't get them until either July or even August. So the food bank is making every effort to stay in front of this and maintain an inventory to continue meeting this increased need. However, in spite of all these factors, Riverbend Food Bank in specific and food banks in general have responded to COVID-19 in a significant way. Riverbend Food Bank distributed a record 1,825,284 meals in the month of April. This was up 34% from the average over the previous 12 months. And then the Feeding America Food Bank Network, that's the national network of 200 food banks, has distributed 1 billion meals since the onset of COVID-19. And that 1 billion meals in 2 months compares to just over 4 billion meals that we distributed together over the previous 12 months nationwide. I always want to emphasize that for anyone out there who needs food and doesn't know where to turn, because there are so many people who have never needed the help of a food bank or food pantry before in their lives, is they can visit our website, riverbendfoodbank.org, and click on Need Food. And please do not hesitate to get the help you need. That is why we're here. People in need may also apply for SNAP right over the phone. This is the new name. So the Supplemental Nutritional Assistance Program, that's the new name for food stamps. It's also called the Link Card in Illinois and Food Assistance in Iowa. In Illinois, residents may call our partner food bank, the Northern Illinois Food Bank, at 844-600-7627. And Iowa residents call the Iowa Food Assistance Hotline at 855-944-3663. Neither of these, it's not government representatives. These are friendly food bankers who answer the phone and can literally take their SNAP application right over the phone. I'd highlight that SNAP benefits have been increased, and beginning just this week, there's even the option to use them online, which is be very helpful to people. Lastly, I just would like to thank the many people who are making this possible. Obviously, the food bank's role is very visible in this crisis, but there are thousands of people who are making this work. First, the food bank staff who are carrying a much heavier load without the hundreds of volunteers we normally have on any given month. Also, only 11 of our 300 partner agencies have currently closed. And this is hard work, but it would be so much harder if they had all closed down and weren't out there helping us distribute food. There's also the companies and foundations who are supporting our skyrocketing expenses, and an amazing number of individuals who are donating to the food bank, many for the first time ever. And to all of these folks, we give our heartfelt thanks. Anyone else who's able to help is welcome to visit us at riverbendfoodbank.org and click on Donate. And that's the end of my prepared remarks.
Thank you, Mike. We appreciate you being on and discussing the important topic of food access right now in our community. We are going to go to the chat. I've been monitoring that. Please type in any questions that you have for Ed, Nita, or Mike, and we will go ahead and respond accordingly. So please let us know if you have any questions.
Brooke, it's Janet. Don't forget the questions that we received early today.
Oh, yes. Do you want to go ahead with those questions, Janet?
Sure. Nita, what is the total confirmed cases at the Tyson plant for Rock Island County residents?
Sure. For Rock Island County residents who work at Tyson and have been COVID-19 positive, it was 134, and that number has remained stable for the past couple of weeks. So we really feel that the mitigation efforts that they are using at the plant are working. So that's good news. And then I also saw the question about being tested in Rock Island County. So at this moment, we are certainly working toward anyone being tested. I know the governor's goal, everyone's goal is to have ability to have anyone tested, but currently we're not quite there, but we are working hard on that. And the current guidance for testing in Illinois is anyone that has COVID-19 symptoms, cough, short of breath, fever, or the other symptoms that were added, chills, abdominal pain, nausea, diarrhea, all of those different symptoms, and have a risk factor. Maybe they have been exposed to somebody that has a positive test or a compromised immune system. All of those people can be tested. And then also anyone that is an essential worker of any kind, so grocery stores, paramedics, police, firefighters, truck drivers, all of those sorts of people. And that is if you're symptomatic or not. Any of those essential workers can be tested.
Thank you, Nita and Janet, for that. We do have a question here for Mike. Is Riverbend still preferring monetary donations only? And can you repeat the number for folks served in the past month or two?
Sure. So I guess I always prefer monetary donations. That because in normal times, every dollar provides 5 meals, and a person can't go to the store and buy 5 meals for $1. But especially during these times, monetary donations are preferred. And then the number I gave was not people served, but number of meals distributed. And that was a record 1,825,284 meals in the month of April.
Thank you, Mike. We'll give it just another second to see if anybody has any additional questions before we conclude the briefing for today. Okay, I think we'll go ahead and conclude the briefing with no additional questions. Mike, thank you again for joining us, and Ed and Nita for being on our calls weekly, so we do appreciate that. This will be our last call for the week. We do anticipate hosting 2 calls again next week, so we will be providing you that information. And if anything changes in the meantime, we will let you know, and you can expect additional information from Janet or Nita for Rock Island County, and then the state will continue to update numbers over the weekend for Scott County. Thank you all for joining us, and have a nice end of your week and weekend.